Today, on this episode of The Crossover, we will be discussing the transition from neurosurgery to journalism with Emmy Award winning CNN Chief Medical Correspondent, Dr. Sanjay Gupta. Learn how one of the most decorated journalists in history started his career as a physician and quickly evolved into the world's leading health news name. Much more on this episode of The Crossover. Good afternoon, everyone. We have the pleasure of speaking with my friend and colleague here, Dr. Sanjay Gupta. He is the multiple Emmy Award-winning chief medical correspondent for CNN and host of the CNN podcast Chasing Life. As everyone knows, Dr. Gupta plays an integral role in CNN's reporting on health and medical issues, both domestically and internationally. Since 2001, Dr. Gupta has covered some of the most important healthcare topics in the US and around the world. Most importantly, in addition to his work for CNN, Dr. Gupta is a faculty neurosurgeon at Emory and associate chief of neurosurgery at Grady Hospital in Atlanta. In 2019, notably, he was elected to the National Academy of Medicine, which is one of the highest honors in the medical field. And his background, Sanjay is a true Wolverine, having received both his undergraduate and medical degrees from the University of Michigan. And good luck in the college football playoffs versus TCU. Should be a great game. And here today to really discuss his incredible transition from neurosurgeon into world-renowned journalist. And again, thank you so much, Sanjay, for joining us. A real pleasure.
What a pleasure for me. Thank you for having me. I am a big fan of yours as well and jumped at the opportunity to be here. So thank you. Thank you for having me.
Awesome. And, we'll just get into it. I mean, when did you first get interested in journalism? Was that something college, medical school?
It's a little bit of a strange and serendipitous story, Ricardo, which I guess when people dissect their own stories, they often are. Journalism wasn't necessarily the tug. I was when I was in medical school and then even in residency a bit. I was writing a fair amount at the level of a person in their early 20s. So not stellar, sort of knock your socks off writing, but I was writing a lot about healthcare policy. And I was very interested in health policy, and I thought clinicians should be a greater part of that discussion. I subsequently worked at the White House for a while, domestic policy issues, but primarily health policy. And I think it was the first time that I sort of got a sense that people really do communicate some of these important topics differently. And there were a lot of lessons that I learned from that time. I was writing speeches for the president and the first lady and really diving into, you got 5 minutes to talk about subspecialty reimbursements. You got 10 minutes to talk about how does the United States stack up to 14 other countries around the world with regard to outcomes, whatever it might be, and how do you really condense those messages in a way where you're not committing sins of omission. All of that to say that there were people that I met when I was at the White House that worked in the media, and they wanted to increasingly talk about health policy. Keep in mind, again, time frame is the late 90s at this point. And when I decided I was going to move to Atlanta, I had been in touch with some of these folks. This is years later now. I've been in touch with some of the folks at Emory and at CNN, and they basically said, "Would you talk about health policy on television?" Kind of like the same sort of thing you were doing at the White House, this was going to be like the Sunday morning talk show sort of gig, Ricardo, panel discussion. Today we're talking about healthcare costs $4 trillion. What are we going to do about it? That sort of thing. And then 3.5 weeks after I started, 9/11 happened. Look, everybody's world changed. Your world changed, my world changed. But they also came to me and said, we're probably not going to be talking about health policy for some time, but you're now a doctor working at an international news network in the midst of what is happening here in the world. Do you want to, cover some of these things? The attacks in New York, people who had survived but were badly wounded, the anthrax attacks that occurred in October of that year. And then ultimately, even the conflicts in Afghanistan and Iraq, and I was interested in these things. I think part of it was from neurosurgery training. One of my professors, John McGillicuddy, who you may know, he would always say in the operating room that, so many of our greatest lessons in medicine and surgery have come from the battlefield. It was something that really stuck with me. And so I embedded with these doctors, remarkable doctors, surgeons, corpsmen who were providing care for the Marines. And that just sort of it sort of spiraled from there into all these different tangents of life. But that's how it sort of started. Not very strategic, but sort of serendipitous.
I mean, so kind of crazy, right? It's such a competitive field and everyone's looking for a break. In some ways, your break was 9/11.
Yes, I would say that that's true. And frankly, if you look at many of the journalists who are on television today, at this, it's been 21 years, right, since 9/11. Many of them started in 9/11. Anderson Cooper, Paul Ozan, Aaron Brown, all these folks, many of them, their first days on television were 9/11 because they were scheduled to start like the following year, but all of a sudden they said, hey, 9/11, you're starting 3 months early because this is the biggest story and most important story of our lifetime.
Now, interesting to me is that you made that transition so smoothly, and obviously it's very competitive. There's obviously journalism school and the type of training that goes into it. Did you have to do a crash course or certain formal education, or were you just pulled right in and here you go?
It was mostly the latter. I mean, that's one of the, I think, advantages of cable in a way, is that when you're doing a 24-hour news network, there isn't a lot of ramp time. You just it's kind of like the OR, see one, do one, teach one, sort of philosophy. I'm obviously exaggerating that a little bit. The OR is far more important, but it's just that you watch. And I think the interesting thing in some ways, Ricardo, is that the best preparation probably for the type of reporting that I was doing, at least mostly initially, was probably being in the clinic, seeing patients. How you talk to a patient. I mean, think about when you're talking to a patient versus your colleagues, your word choice is different. You want them to understand, so you're using words that they understand. There's an empathy to it. You understand that they're at a very vulnerable time in their lives. So it was actually my wife, Rebecca, who sort of made that click, because thankfully I started before the digital era, so you can't go back and find some of those first first live shots I did. I joke around with some of my bosses that I questioned their judgment that they kept me on the air, because it was stilted, it was awkward. I think there's no question that when you first start doing something like this, it is a foreign thing. But once, as my wife had suggested, you start thinking about the camera and the lens as a patient, as somebody who you're trying to take care of, or somebody's mother, or your own mother, whatever, it's just a different style of communication. And frankly, I think doctors are actually quite good at it. I mean, I think it's, even if you haven't had formal training in it, because you spend so much time in the hospitals taking care of patients, you just develop that style.
And the other thing that I found so fascinating is that many of the medical correspondents are primary care physicians. They have a very broad background in medicine because you're covering so many stories. Now, you're unique in that you are a super subspecialized surgeon. And so, did you have any unique challenges as a subspecialist covering general medical stories? How did you keep up with your medical knowledge? How did you educate yourself?
Well, I think that the goal a lot of times when you're reporting on this or covering something is that you want to make sure that you're providing enough knowledge to the viewer that it's going to be helpful to them, but we're not giving grand rounds here. So frankly, I think that for most doctors, and I would say, Ricardo, I don't even know that you need to be a doctor or somebody who's formally trained that way to do medical journalism. Some of the best medical journalists are not doctors. I think they're incredibly talented at what they do. I joke around that maybe some of them should get ancillary medical degrees, given all that they continuously research. Some of our producers have been there for a quarter century. They read the journals every day. They read the journals more than I do, and I'm just being totally honest here. That is their life. That is their lifeblood, and they're very good at it. Interestingly, if you look at the medical correspondents who are doctors, many of them are specialists. Actually, John LaPook, who's a close colleague at CBS, he's a gastroenterologist. I guess started in primary care, but it's very specific to gastroenterology. Jen Ashton's an obstetrician. Mehmet Oz, when he was doing it, heart surgeon. I'm a neurosurgeon. So there's a lot of people who are in that subspecialty world who are doing this sort of work, but I don't think it necessarily matters. And I'm not even sure that you need to be a physician to do it. I think it probably gives you a greater air of credibility, and also the sense that you are working in a hospital. You kind of have your thumb on the heartbeat of things, the less intuitive things. I'm constantly talking to my colleagues and my residents, the nurses, and the medical students, trying to understand how they're looking at certain situations. It's I think it's really helpful. I'm a more informed reporter because of my background, but I think that 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 being informed can come from all sorts of different places.
This episode is brought to you by Rogue Fitness. Rogue is a leader in the fitness industry and a great choice for workout programs. I use my Rogue pull-up bar for a few hundred reps daily. It's an easy way to combine work and wellness. Check out rogue.com for more information and use the promo code crossover for 20% off your first order. That's crossover for 20% off. Who would you say was your biggest mentor during this transition from full neurosurgeon to journalist?
You know, I wish that I had had somebody in my life at that point to really be, I think, the mentor. I, and some of it was like very practical. Like, how do you organize your life? Um, People who are continuing to practice and do this sort of work, how do you organize your life? How do you talk to disparate groups of people, like my colleagues and friends at Emory, and my colleagues and friends in the media? Like, how do I let them both know what I'm doing and be honest about it? I think there was one person, Timothy Johnson, Dr. Timothy Johnson, who was at ABC and was sort of the medical correspondent at ABC forever. He was the guy that I watched growing up, and he didn't know me at all. But when I first started thinking about this, when CNN had sort of come to me with this healthcare policy commentary offer, I cold called him,
Wow.
and he had no reason to. He didn't know who I was. He had no reason to answer the call, and he called me back half an hour later, and probably spent about a half an hour on the phone with me. And I never forgot that. I never forgot that he did that. And I guess it's the whole paying it forward thing. A lot of times I get calls from young medical people, doctors, whoever, that want to get into this world, and I try and make it a point of spending time talking to them for that reason. So he was probably my biggest sort of mentor in this regard. But I found a lot of people who were very, very helpful within CNN and CBS. 60 Minutes, right, was doing pieces that they just took the time to steer me clear of things. The biggest things, Ricardo, is that I think you go into this field and you think, okay, I kind of know what to do here. I there's a lot of non-intuitives. It's the intuitive stuff you got. You can figure that out. It's the I did not know that. I did not realize that. I did not realize you had to take a commercial break at that exact minute. I did not realize that a 14-minute piece is better than a 13-minute piece for the following reasons. I did not realize, XYZ about things that are not directly related to how I report a story, but are necessary for me to work in that machine. So those were the interesting lessons that came.
What would you say is the single greatest challenge you faced during this transition?
I think it was this balance of life. I came down to Emory thinking I was going to primarily be doing neurosurgery and Sunday morning talk shows, other stuff, commentary here and there, but not much. Within a very short time, the demands, because large part driven by 9/11, the demands changed, and sort of really finding that balance. And as part of that, and again, this is, I say this with humility, because I'm not saying this is the only way to approach something, but what I did very early on was I did a grand rounds at Emory, and with all my colleagues, and like you, Ricardo, many of my colleagues in the Department of Neurosurgery are also some of my best friends, right? So there's this relationship, but I did not want to in any way take advantage of that. So I did a grand rounds and said, hey, look, this is what I'm trying to do. I think it's important for medical voices to be part of the reporting on these medical topics. I think people who are informed reporters in the way that I was describing, that's important. I made the case. I gave data on why I thought that was important. And I also said, look, this is how I want to structure my life, basically a 50-50 split. And, just being candid, because I mean, everyone who's probably listening, understands this, but that reflected my money, my salary. That reflected, I took extra call in the beginning to be able to really, make the case that I belonged here, should be here. I mean, surgeons as a general rule are people who they want to be in the game as much as possible. Put me in, coach, put me in, coach. And so I'm one of those guys. But I also recognize that the trap was that I could become a jack of all trades, a master of none. And I just felt like complete transparency with my Emory colleagues and also with my CNN teams. We have large teams of producers and executive producers and directors. And I sat down with them and I said, there's going to be days when I'm simply not available. It's going to be a couple days a week, 2.5 days a week on average. And that's sacred time. I mean, so one person at CNN has the phone number into the operating room, one person. And it's probably been used in 21 years that I've been doing this, probably been used half a dozen times. So they really respected that time. And look, I mean, what you do, what I do in the hospital world is far more important, frankly, than television. I think everyone gets that spends 2 seconds thinking about it. So they really did protect that time for me, which made it work. But I think finding that balance was probably the hardest part.
Now, the other question, which I find also fascinating, is tell us why it's so important for you to maintain your clinical practice, given all your success that you've had with journalism. Many people would say, well, why doesn't he just stop being a neurosurgeon and just do journalism? Why is that so important to you?
Well, I think part of it is that I really do love it. I mean, I think I've come across physicians who probably look at their work as a job, and I think when they do that, they start to focus on the negative aspects of the job more than the positive aspects. I get it. That's not a criticism. It can happen. Um, I think in some ways, straddling two worlds the way that I have has allowed me to focus on the best parts of both careers and minimize the negative stuff. It's not that I've eliminated the negative, but I've minimized that. But I love it. I love being in the operating room. I love being with my residents. I love the presence that is required. I mean, you can't have your phone. I'm not. It's. I think as you and I were talking before we even started the podcast, um, because I think I've worked in so many sectors of society now, public service, the White House, corporate America, media, academic centers, things like that. What you do, what I get to do, um, it really is the best job in the world. I mean, we people cannot overestimate the value of that sort of work satisfaction. I operate every Monday. When I get up on Monday mornings, my wife will say to me, "This is the happiest time of your week. I'm ready to go. I don't hit the alarm. I know what I'm here for on those days, and I just think it's very hard to replicate. I don't want to be preachy about this, and again, I don't want to minimize people who have, they're trying to figure out their careers, and there's goods and bads. But being a doctor is it's a real privilege. And I have 3 teenagers now, as I was mentioning, and they've talked about medicine. And maybe you get this as well. If a young person comes to you, says, I'm interested in medicine. And I've heard doctors say, oh, no, my God, it's a $4 trillion albatross. Don't get involved in that. It's a mess. And I've never said that. I think it's the best job in the world. So I want to keep doing it as long as I can.
I love hearing that because I preach that to every person who will listen, that I think that as doctors and particularly as neurosurgeons, the impact that we get to have every day,
Yeah.
unreal. And I tell people that I absolutely have the best job in the world. And for you to say that just kind of verifies it. So I'm glad to hear you say that. Do
Yeah.
you think that there's any parallels between neurosurgery and journalism?
It's a great question. I think that there are parallels, and what is interesting is that I would take it a step further and say that a lot of journalism, like if I were to break it down, the type of work I do, we do a lot of taped reports. So these are things that I've gone out and filmed in the field, and I've turned it into a report now that's taped and it's going to air, versus live reporting where you're on the scene somewhere or even in a studio somewhere and you're just live reporting. There's no prompter. And I think that the live reporting, especially in the field, is more like surgery. You don't get another shot at it. This is it. You got to get it right, and you're doing it live, versus tape programming, which is more, I think, like internal medicine, where you have time to sort of try different meds and see patient comes back and try different things. So, I've really broken it down, tried to find those parallels. I think in both surgery, neurosurgery specifically, maybe even, and journalism, you have to make decisions. You have to make the decisions. You don't have a lot of time to sort of just equivocate over things. At the end of the day, the decision has to be made. And when you're covering a war, or you're in a natural disaster setting, and you're thinking about how best to report this, but also how best to take care of yourself and your team. Your team will follow you into any situation that you lead them into. And sometimes those situations can be really dangerous. And I'm very close to some of the people I've worked with, Ricardo, I've worked with the entire time I'm here. There's been no churn. It's amazing. I mean, these are, and they've been in war zones with me. We've been shot at. We've driven over improvised explosive devices. A guy next to me was rendered paraplegic as a result of one of those injuries. So, there's the similarity. Just like you're taking care of patients, you always want to, obviously, you have to make a decision. You want to do the absolute best thing for, in this case, your patient. There's some similarities, I think, in especially live reporting in critical situations.
What was your single most memorable story you've covered in your career? It's probably a really difficult question, but if you have one that just stands out.
Yeah, it is hard, and and it's like, I mean, the most memorable stories are often ones that were born out of tragedy, and to pick one that is the most memorable is not in any way to minimize the other tragedies, because I as just a philosophical principle, I will say this, Ricardo. I think you'll appreciate this. Uh, some of the strongest relationships I've had in my life were made during times of great tragedy. I have, lots of friends. Well, I don't actually have lots of friends. I have a few friends, but I friends that I've met through just being in the community, and usually my kids' friends' parents is how I have most of my friends. They you're it's a good relationship, but it's not fortified with anything. When you're in the middle of an earthquake in Haiti, and 100,000 people died within minutes, and another 100,000 would die over the following weeks and months. The types of relationships you build with people in those situations are the most powerful relationships I have in my life. These are people who've stood up at my wedding, people who I will call at 4 o'clock in the morning when I'm worried about something. May have nothing to do with them, but I just know they get it. That's their headspace. But I do think that probably the earthquake in Haiti was maybe the most memorable. It was the largest mass casualty scene probably ever really seen in the world, because we were there within 12 hours of this earthquake, which is happening in Haiti, the poorest country in the Western Hemisphere. And we got there before the military. We got there before lots of relief organizations. Journalists get into situations very, very quickly. And then also I was asked to operate when I was there. And I think when you have this colliding of your worlds, which has happened to me several times over my career, those are very memorable. You never think it's going to happen, but then all of a sudden it does, and it's indelible in your life.
Yeah, I mean, I can't even imagine what you guys saw there. It must have just been horrific. Looking ahead, I mean, you've accomplished greatness in two of the most competitive careers possible. I mean, where do you go from here? What's your next challenge?
Yeah, I don't know at what point in life we stop asking that question, right? I mean, I don't know. I'm in my early 50s now. I'm not old. I feel like I'm hitting my stride pretty well right now. I'm not tired yet. My faculties are all working pretty well. I don't know. I do think there's something to be said for continuously just getting better at what you do. I mean, I think in some ways, the athletic sort of parallels is important. People who are athletes are constantly just trying to shave time off of their whatever feat they're performing. And I do like the idea of writing books. I think books do have a sense of permanence. I think television is by its very nature a very ephemeral sort of thing. Here today, gone, not just tomorrow, gone 20 seconds from now. I mean, it's crazy. Sometimes you work really hard on something, and then the news cycle changes, and all of a sudden, the thing that you spent the last several weeks just nailing down is no longer really there. Books, I think, is important. I'd like to continue to write. I think the one itch that I've not ever really been able to scratch, and I hear this from a lot of my colleagues in medicine as well, is the idea of just building something. Being able, whether it's something squarely in medicine or within healthcare more broadly. I think as journalists, you get to see problems in a way that's different than how I used to see them before. You get to understand potential solutions in a way that was different than the way I looked at things before. How do I take some of those skill sets and put them together? Maybe that would be something I'd like to do. I will say this: I will leave television at some point, probably not in the too distant future. And it's not because I don't like it. I love it. But hey, if life were infinite, I'd make different choices. I just want to try something different for a while. And so what exactly that is, I'm not sure, but probably along the lines of what I'm describing, to be able to scratch that itch of building something.
So last question, because I know you're obviously super busy. You are a role model for so many. What would be the one piece of advice you would give to anyone trying to emulate you, trying to follow your footsteps? What's the key that you would tell them?
Um, it's gonna sound maybe a little trite, and keep in mind you're hearing this from a guy who's fully immersed in the life of three teenage girls right now. So I think about this stuff all the time. But you know what I'm doing now, Ricardo, I didn't even, not only did I not think of it, I couldn't even have imagined it when I was in medical school and even residency. This life was not something I could have imagined. And I think what I knew maybe was the sort of things that I like to do. And I kind of just spent a lot of time getting good at those things that I like to do: the writing, the speech writing, the healthcare policy stuff, obviously training in neurosurgery at Michigan, all of that. And then things just sort of came together. So, when I say figure out your strengths and run to your strengths and other things will follow, I know that sounds trite and it doesn't always work out that way for everybody, but I do think it's still the best path forward. I think, emulating someone like me or whoever it may be is fine, because I think it's a good way to have a path, but it's what I do for a living. This job may not exist in 10 years. I mean, the media landscape is totally changing right now. People aren't going to consume content the way that they do. But if you are somebody who's listening to this and like the idea of what I do, then think about what the world's going to be like in 10 years. And as I guess, was it Gordie Howe or Wayne Gretzky or somebody said, go to where the puck is going, not where the puck is,
Wayne Gretzky.
Wayne Gretzky, yeah. So, it's one of those things I think that's probably important. Read a lot. I mean, the thing about bifurcating a life is that it can be a very humbling sort of experience. And you are again, old adages, but the more you know, the more you realize you don't know. And so I thought I knew everything, and I didn't. And so I read a ton. I happen to have a chairman of neurosurgery, Dan Barrow, who is just a voracious reader. And he and I will trade book titles all the time, and then sit down, him usually with a cigar, me not, and talk about these books that we've read. So I'd say that was the other thing. And it is possible to have a bifurcated life. I think doctors used to be seen, and not just as people who could help heal you, but they were often the people that you'd go to with questions about society, about how to live your life, about how to move forward. And I think as we become hyper specialized, we've gotten away from that. But I think it is quite possible for people who are physicians or in the healthcare world to seriously pursue other things, not just dabble, but seriously pursue other things and use a lot of the skills that you learn in medical school and training towards something else. But don't stop don't stop practicing medicine, like we were talking about. Don't That's like maybe the biggest piece of advice. I know there's a temptation. I hear a lot of my friends, they go into banking and they become consultants at these big companies. I'm sure, again, it's great and all that, but I do worry sometimes that they're missing out on the tremendous joy that one gets from taking care of patients, and that there's just nothing like it in society. Everywhere I've traveled, every place that I've been, every aspect of our society that I've inhabited, it's nothing like it. So maintain that.
What an amazing interview, Sanjay. I think there's really two take-home points. Number one, think outside the box. Don't get limited in what people say you can do or you can't do. You're an example of that. You followed your passions, followed what you were good at, and you became great in two separate fields. Very unconventional, but obviously works. So I think that's kind of lesson number one. And I think the other lesson that you really stressed is that medicine is the greatest field on the planet. And I tell everyone that. And to hear someone like yourself who has so much success in another field and could very easily leave medicine without any problems. And the fact that you still make it a point to practice, keep up your skills, and that you're so passionate really kind of resonates with me. That's awesome to hear.
Well, I appreciate that. And I can assure you it's all authentic, Ricardo. I mean, I enjoy these types of conversations because I don't know, life seems like a bunch of sound bites sometimes. So the idea that we can actually sit down and have a conversation like this is it's greatly appreciated. And I meant every word that I said.
Awesome, Sanjay. Well, have a great rest of the day. I know you're super busy and you are a role model for so many. So again, congrats on everything you've accomplished.
Right back at you, Ricardo. Hope to see you in person sometime soon.
Absolutely. Take care, man.
Okay, you too. Good luck with the tumors today.
Thanks, bud.